My name is Kent Ellis. My job is to provide patient warming systems to the healthcare environment. I'm the design developer for Pintler Patient Warming Systems. We provide 3 products presently. We have the Peak product, which is your standard OR table designed to warm all patients during all procedures. We have the Summit product designed to provide orthopedic warming or use of apparatus warming, whether it be a beanbag or whether it be a shoulder brace. The other product we have is a product called Vista, which is pre and post-op warming of the patient, ER warming, or any place where you would hold a patient in any time awaiting procedure or diagnostic. So what we have is a full family of product that is non-disposable, that's designed to deliver warming to all patients and pressure reduction to all patients at all times.
Hello, my name is Tammy Nash and I work for Pintler Medical, and this is the Pintler warming system. This particular pad is the Peak pad. This is the headpiece, the torso pad, and the foot pad. The torso pad is the section that has the warming element in it. This is the power supply unit. On the back side, we have our on-off switch and our plug. We can turn it to on. And once you do, you'll see a standby light illuminate. You can press the on button, and then to warm the patient or to get a higher temperature, you press the up arrow to whatever your desired temperature is. If the cable is to become disconnected, it will not damage the cable or the unit itself. You can do a systems check by pressing the down arrow and the alarm mute button simultaneously, and you can see all lights illuminate. Now the Summit pad warms very quickly. It only takes a couple of minutes. The first case of the day might take a couple more minutes, but in general it just takes a couple of minutes to warm. It is highly flexible. Not only can it be utilized in this position, it can also be utilized in a beach chair for shoulder surgeries. It can be utilized for patients in a lateral position with bean bags. Just set the bean bags down, put the pad on top of the bean bags, and let it sit right inside of the beanbag itself. So how do you take care of the Summit? Because it's not on the bed all the time, it is important to know. First of all, cleaning. You clean it just like you do any other pad that you currently have. And for storing, I recommend rolling it to store it. You want to make sure you preserve the elements inside, the warming element inside the pad. So rolling it is a good option. You can also store it flat, but what you don't want to do is store it with stuff on top of it.
Hi, my name is Lance. I'm with Pintler Medical. I'm going to introduce you to our heated stretcher pad. This is the Vista. It's a basic pad. The nice thing about this is it's heated. The unit comes with a pendant control for the patient to use. They can turn it on to warm, warmer, and warmest. What's nice about this is the patient has the opportunity to keep themselves warm. Let me show you how the patient controls their own warmth. This hand control is only activated with at least a 5-pound weight on the stretcher. So the patient has to be on the stretcher for it to be activated. Here's how the patient controls their own temperature. You push this blue button here, and it's a simple press of the button, goes up and down to warm, warmest, and warmer. When the patient leaves, it'll go right back into standby mode.
All patient warming is the same. It is called redistribution, where you are warming tissue, and that tissue warms blood flow in the patient's body and maintains normal thermia. The median to warming all patients is skin. Pintler is the best in the world at it because we warm so much skin surface, whereas other devices and products warm elements of the skin in a very small area. We're warming the patient from the buttocks to the neck, and we're giving as much skin contact to active patient warming as possibly achievable safely. Pintler Patient Warming System complements the basic laws of physics. Heat rises, heat goes to cold. When the patient's body temperature is below 36 or below 37 C, Pintler Patient Warming System at 40 plus C is actively warming the patient. This is basic sound physics. Heat rises. When you're topically trying to warm a patient, you're doing nothing more than an evaporation barrier. We are putting thermals into the patient to replace the loss of thermals. In patient warming today, the standards are PQRS, which is physician quality measurements. Pintler complements those measurements every time, every patient, every procedure by simply putting a skin temp probe on the patient and knowing that you're getting active patient warming in excess of 36°C. Pintler offers more effective patient warming than any product offered today.